Okay, so we'll be discussing today about the lymphoid system. So we'll be discussing about the maturation, the differentiation of our lymphocytes. We'll be talking about here the lymphoid cell lines for the development of our T lymphocyte, your B lymphocyte, and we have your NK or natural killer. So first we have here the hematopoiesis. So basically our hematopoiesis is divided here into three stages or phases. The first one we have here your mesoblastic phase. In the mesoblastic phase, it is the yolk sac that try to be the first site of our blood cell production starting on as early as the second week age of gestation and try to persist up to 8 to 12 weeks age of gestation. However, during this phase, it's only limited with our RBC production or erythropoiesis. It's only limited as well here with only with the development of the um, embryonic hemoglobin. Okay, the next phase we have here the hepatic phase. Hepatic phase here, so it starts on second month of the age of gestation where the liver participate in the blood cell production. During this phase, not only limited for the RBC production, but as well as with the other blood cells, including your granulocyte, monocyte, and of course here, the latter part would be your lymphocyte production or the lymphopoiesis. And the last phase, we have here your myeloid phase or the medullary phase, where our bone marrow become the chief site of our blood cell production, starting on the 5th month of the pregnancy. Okay, and after the delivery, after birth, so our blood cell production would be highly dependent on our bone marrow. Okay, we will not be discussing much of this one because we have discussed this already in your HEMA. Okay, so we have here the phagocytosis. So the phagocytosis is a process whereby your phagocyte, that includes your granulocytes, neutrophil, basophil, eosinophils, plus your monocyte and your macrophages try to engulf the pathogen primarily to eliminate that one in our body. So we have here the steps for the phagocytosis. Okay, we start here with the chemotaxis. So chemotaxis is just the attraction of your phagocyte towards the tissue injury. Okay, so what drives primarily our phagocyte to know that there's a tissue injury in your body because of your chemotaxins. Chemotaxins are your complement components like your C3A and C5A. Okay, we have here the type of the migration. So you can have here the positive chemotaxis, that is a migration towards the site of your tissue injury. We have also here the negative chemotaxis, which is the migration away or the movement of your phagocyte away from the site of your tissue injury. Okay, the next one, diapedesis, is just the migration or paglalakad ng ating mga monocytes and macrophages or your phagocyte from within your blood vessels or in the blood area to the tissue area. They're able to go to the tissue area by passing through your blood vessel wall. They try to insinuate themselves within that one, and you call that process here diapedesis. Okay, we have here your phagocytes. So these are the basic, the two main phagocytic systems. So first we have your neutrophil. The neutrophil here is actually the first phagocyte that is being activated. The first try to be activated if you have your tissue injury. And usually your neutrophil try to migrate. And usually this one is being present during the acute inflammation because that's what is the first to be activated or the first to migrate. Okay, the lifespan of our neutrophil, we have here 5 days. And we have here, when your neutrophil try to die, it become here your small pus cell. Monocyte, on the other hand, is being activated on the latter part, and usually that one is the one proliferating during your chronic inflammation process. It would have a longer lifespan compared with our neutrophil. It can survive up to several months, and then when it die, they become here your large pus cell. Okay, the next stage of our phagocytosis, we have here the opsonization. So when speak about the opsonization, so it's a coating of your pathogen by our opsonins that will render our pathogen here to be tasty to our phagocyte. That will also enable our phagocyte to recognize that this is the pathogen in order for that to kill. Okay, so para makilala niya. So our opsonins could be in the form of your immunoglobulin, the IgG antibody, or it could also be your C3 component of your complement. So anong ginagawa nito? I-try to coat here your pathogen. Okay, so para makilala siya ni phagocyte. The phagocyte could not recognize it. For example, if this one is your pathogen, pag wala dito naka-code sa kanya na C3 or IgG, your phagocyte could not recognize that one is your pathogen. And if could not recognize, it will not kill that one. Okay, so that's how important our opsonins. Okay, the next one, so after I try to recognize this one is our pathogen, your phagocyte try to bind or try to stick, okay, to the surface of our pathogen by the process we call here as your adherence. Okay, so we have here substances or molecules that facilitate our adherence of the membrane of your phagocyte and the membrane of your pathogen. So you can have your CAM, capture adhesion molecule, or you could also have your chemicals like your P-selectin, and we have also here your L-selectin. Then after they try to fuse, so eventually your phagocyte try to encircle your pathogen and try to engulf. Okay, that's your endocytosis. Okay, then once it try to engulf already our pathogen, the pathogen try to go within the vacuole of your phagocyte. You call now here as your phagosome. Okay, then after that one, if you have already your, when speak about again your phagosome, so phagosome here is just your phagocyte wherein the vacuole of that already contains your pathogen. And after that one, your phagosome try to fuse with the granules content of your phagocyte. Remember that our phagocytes, specifically for example, our granulocytes, they contain the primary granules, they contain secondary granules. Okay, all of that contains different enzymes which are cytolytic, which are cytotoxic. So that will be the one going to kill our pathogen which has been ingested by your phagocyte. So if you have your phagosome already, try to combine or try to fuse with your granules content of your phagocyte to form here your phagolysosome. Okay, then they try to degranulate, labas ng granules para mag-fuse sa ating phagosome. Remember here that, again, the granules content of our phagocytes are cytolytic. They're also hydrolytic. So, meaning to say these are toxic to your pathogen that will be responsible here for degradation or digestion of our pathogen. Okay, as our view, we have here the different types of your granules. So you can have here the primary granules. Primarily, you call it what's your non-specific granules or our azurophilic granules. So example for that, in the case of your neutrophil, you have your MPO, your myeloperoxidase. Then secondary granules is your your specific granules. And that one example for that, we have your lactoferrin. And we have your tertiary granules. So you can have your capsaicin for that. Okay, now we go to your killing or digestion process. Again, there are two processes of the killing. One is your oxygen dependent. Another one is your oxygen independent. Pag oxygen dependent, okay, it requires hydroxyl or it requires your hypochlorite or you call it was your radioactive radicals in order for that to kill or to digest our pathogen. Okay, so we have here the process of your respiratory burst in the presence of our oxygen. So this is oxygen-dependent killing or digestion process. Okay, so we have your NADP. So it will be added with your hydrogen ion here through your hexose monophosphate shunt pathway. Then NADPH will be catabolized here by NADPH oxidase to form here your superoxide radical plus your hydroxyl or OH, pwede din siya. Then your superoxide acted upon by another enzyme, superoxide dismutase, converting this one to your hydrogen peroxide. Then hydrogen peroxide will be acted upon by peroxidase. Example of that, we have the MPO. MPO here is, okay, the primary granules content of your neutrophil that will convert this superoxide, that will convert, I mean, your hydrogen peroxide in the presence of your chloride ion to form here your hypochlorite. Or parang bleach, di ba? Parang ganun siya. And this one is toxic to your bacterial cell. And this will be going to kill or digest your pathogen which was ingested by our phagocyte. Okay, so we have also here the other way of killing of the or digestion of our ingested pathogen could also be in the form of your oxygen independent killing process. So when speak about the oxygen independent, this is the digestion process wherein you don't need the presence of your oxygen. So it might be in the form of number one, change in the pH. So from the neutral pH to from the alkaline pH to a neutral pH. Why neutral pH? Because again, our enzymes try to work best in the neutral pH. Then we have also here the fusion of the other component of the granules of our phagocyte could also help here in the digestion process, even without the oxygen formation. Okay, then we have here the disease. We call this one as your CGD or the chronic granulomatous disease. So the chronic granulomatous disease is characterized by the absence of the enzyme NADPH oxidase. So remember that the NADPH oxidase is needed in order for you to produce your hypochlorite with your oxygen-dependent respiratory burst process. So if the patient, for example, do not have the enzyme NADPH oxidase, so what's going to happen here is that you're not able to produce your hypochlorite. And therefore, your phagocyte can ingest your pathogen but could not kill that one. And what you have for that would be your recurrent bacterial infection. Then we have also here another virulence factor for your pathogen, especially for our bacteria. We have your coagulase. So especially for your Staph aureus is your coagulase positive. Okay, so coagulase is the enzyme, is a virulence factor that try to convert your fibrinogen to your fibrin clot. And because of the presence of your fibrin clot, that will enable our coagulase positive bacteria here to hide within the fibrin clot, and therefore it can evade or it can escape your phagocytosis because your phagocyte could not recognize and identify the presence of your bacteria because they are within your fibrin clot. And therefore, they can resist the phagocytosis out of that one. And after that one, after your degradation process, so the degraded bacterial fragments will not be released out of your phagocyte by the process we call this was your exocytosis. And the next thing here, this degraded fragments of your bacteria or your pathogen will be presented by our APC or your antigen presenting cell to your T lymphocyte or even to your B lymphocyte. But most like this one's T lymphocyte first. Okay, so we'll be discussing this one ng APC with your antigen presentation with another topic in the future. Okay, next we go to your inflammation. So inflammation is overall response as a consequence of your tissue injury. So inflammatory process is just the manifestation of your tissue injury. Okay, we have here the cardinal sign of your inflammation. So we have here your rubor or redness. We have also here your calor or your heat. And we have also your dolor or pain. We have also here your tumor, swelling, and we have also here the loss of the function. Okay, so we have here the outline of the steps when you have a tissue injury. So if you have a tissue injury, okay, that would first, we're going to happen for that, we have here your vasodilation of our blood vessels. What mediates your vasodilation of your blood vessels? So when speak about vasodilation, lumalaki ang lumen ng size, size ng lumen ng ating blood vessel. Okay, so what trigger here the vasodilation of our blood vessel would be the histamine being released from your damaged na mast cells. Nasa loob siya ni mast cells natin. Actually, your basophil also contains your histamine. So because of a tissue injury, na-damage ang ating mga mast cells, and the mast cells here try to degranulate, releasing here the histamine, and that can trigger the vasodilation of our blood vessels. The consequence of that, okay, so more of your blood will be delivered to your tissue area, okay, and that would eventually result here to redness and heat because of the accumulation of much of your blood to that area. So we have here other vasoactive factors. So they also try to induce here the vasodilation process. So we have your prostaglandin, we have also your leukotrienes. Actually, these are also found as part of the component of the granules of our basophil and mast cells then, aside from your histamine. Okay, the next here, we have your increased capillary permeability. So, ang mga butas ng ating blood vessel membrane ay lumalaki. As a consequence of that, it would allow the leakage of your plasma within your blood vessels going to your nearby tissue. Okay, and that would result to your pain and swelling. And another one, since increase na ang capillary permeability natin, also allows the leakage or the migration of our phagocytes. Okay, within your blood vessels going to your tissue area where you have your tissue injury. Okay, the first to migrate, again, we have here your neutrophil that was being activated first in your acute inflammation. So as early as 15 to 30 minutes, this one, 30 to 60 minutes, your neutrophil already try to migrate on your tissue site injury. It can last for 24 to 48 hours. And later, your monocyte also try to be activated. And usually this one occur or be present in your chronic inflammation process. It tries to be activated here within 16 to 48 hours. Then, clot formation will be initiated to stop the bleeding process, and we have your tissue repair. So depending on how severe the damage is here, so it also be associated with the manifestation of the damage. And we have also loss of the function. Like kung sobrang lalim ng sugat, so expect na magkakaroon ng fibrosis, peklat, okay, sa area ng tissue injury natin. Okay, so okay, now we have here the lymphoid system. So we have your lymphocytes. So the lymphocytes is a mononuclear part of our mononuclear system, including your macrophages and monocyte and lymphocyte. So basically, your typical lymphocytes could measure 7 to 10 micrometer. Actually, can range depending on the type of your lymphocyte. Like a small lymphocyte that's 8 to 10, 10 to 12 for the medium size lymphocyte. You can have your 12 to 16 for the large lymphocyte. Okay, so this is a mononuclear, so the nucleus is round and dark blue. If you try to stain, basically your blood smear with your right stain, your lymphocyte appears to be dark blue, nucleus and the light blue na cytoplasm, and that one do not have here the granules. Okay, so in the WBC differential count, your lymphocyte accounts here for 20 to 40%. And the increased level of your lymphocytes in the case of your lymphopoiesis, that will be related to your viral infection. Okay, we have here the summary of the development and the maturation, differentiation of our lymphocytes, both for T lymphocyte and your B lymphocytes. Start here with your multipotential stem cell or your hematopoietic stem cell. You try to differentiate, then eventually become your lymphoid cell lines. Okay, then we have here the site of the maturation. So we have here your antigen independent maturation. So when we speak about the antigen independent maturation, they tend to mature even in the absence or even without meeting up with your antigen, they tend to mature. So the antigen-independent maturation of our T and B lymphocytes try to occur here on the primary lymphoid organs. This includes here the bone marrow, and we have also here your thymus. Okay, as they try to mature, they try to migrate on the secondary lymphoid organ, where they tend to perform here your antigen-dependent maturation. So speak about antigen-dependent maturation, they try to meet with a pathogen that would render them to become immunocompetent, T lymphocyte and your B lymphocyte. So our secondary lymphoid organs includes your spleen, your lymph nodes, and we have also your mucosa-associated lymphoid tissues. Okay, so we have here the primary lymphoid organ. Okay, the primary lymphoid organ here, other name for that one is your central lymphoid organs. So again, these are your lymphoid organs serving here as the site of the maturation of your T and the B lymphocytes, which is your antigen independent. So hindi nila kailangan mag-meet ng antigen dito for them to mature. Okay, so this includes your BM, bone marrow, which is the primary lymphoid organ for both your B lymphocyte and your NK, natural killer. Okay, the bone marrow, considered here to be the largest tissues in our body, weighing approximately 1,300 to 1,500 grams. And the bone marrow in our body is found here in our flat bones. So you can have your sternum, you can have your sacral crest, and all of that. Okay, so this is the relative percentage of your lymphocytes in your peripheral circulation. Hindi ito ang percentage sa ating bone marrow, but this is in the peripheral circulation or your blood vessel. Okay, the B cells here account for 10 to 20%. The T cells or the T lymphocyte account majority of your lymphocytes in your peripheral circulation. That's 61 to 89%. Then we have your NK, that's 22%. Okay, then we go to your thymus. The thymus here is the primary lymphoid organ for the antigen-independent maturation of our T lymphocyte. Okay, so this is a small, flat, bilobe organ found here within below your thyroid gland, overlying our heart. Okay, so at birth, you have 30 grams. You try to reach the puberty, become 35 grams. As you try to grow old age, it try to undergo atrophy and then it die or it try to disappear if it try to grow older. Okay, there are two areas with our thymus. We have here your thymic cortex. The cortex area is the outermost area. It's served here as the nursing home or the nursing area for your immature T lymphocytes. Or you call it what your thymocyte. Then the medulla part, on the other hand, is the innermost portion of your thymus. It is where your mature T lymphocyte could be found, and that one could already be differentiated with your CD4 positive na T lymphocyte, which is your CD4 positive, you call it once your T helper or T inducer. And then we have also that CD8 positive will be your T suppressor or T cytotoxic. Okay, then we have here your secondary lymphoid organs. So secondary lymphoid organs, also called here as our peripheral lymphoid organs. So our secondary lymphoid organs here try to serve the following functions. So basically, our secondary lymphoid organs try to serve here as the site for the antigen dependent maturation process. Aside from this one also serve here as a site as a trapping site for your pathogen, and it's also the standby area for the mature T and the B lymphocyte. It's also the meeting place for your pathogen and our mature B and the T lymphocyte, enabling your mature T and the B lymphocyte to become immunocompetent in order for that to undergo here your antigen-dependent maturation to become immunocompetent B lymphocyte and your T lymphocyte. Okay, so we have here our secondary lymphoid organs. The first one, we have the spleen. The spleen considered here to be the largest among our secondary lymphoid organs. The spleen could be found here in the upper left quadrant in your intestinal tract or the gastrointestinal tract, usually just below here your diaphragm. Okay, so we have here some of the function of the spleen. So we have the term here pitting. Pitting is the removal of the spleen by the inclusion bodies within your RBC. So as your blood is being delivered to the spleen, if your blood contains an RBC having an inclusion bodies that will be removed by our spleen, by the process here you call this one as repeating. Another one, we have here the culling. The culling is a process whereby your spleen try to destroy those red blood cells having an abnormal morphology. As you try to destroy that one, it would result here to your hemolytic anemia or hemolytic reaction. Another function of our spleen, it try to sequesters our platelets. One-third of the population of platelets being stored in your spleen. And therefore, if you try to remove your spleen, since natago niyang platelet natin, if you try to remove the spleen, splenectomy, okay, that would result here to increase in the platelet count. But in the case of your splenomegaly, it will have your decrease in the platelet count. But if you try to remove your spleen, it will tend to increase your platelet count. Because again, one-third of your platelets in the peripheral circulation is being sequestered in your spleen. Okay, the main function of your spleen, so it took part here on the defense of our body, basically try to remove the pathogen that enters our bloodstream. Okay, we have here the different parts of our spleen. So we have here the red pulp. The red pulp is the red portion of your spleen, and it is where your RBC is being sequestered or being destroyed, okay, in your red pulp. Okay, the white pulp, on the other hand, is made up of the following parts. So we have your pus, we have your periarterial lymphoid sheath. So basically contains, it is where you can find our T lymphocyte. There's also an area, you call this was your follicles, divided here into your primary and secondary. The primary follicle here contains, this is a follicles without the germinal center, so wala na dito sa gitna. Okay, it is the area where your immature B lymphocyte could be found. So pag sinabi immature, this is the B lymphocytes was not yet stimulated or not yet able to meet with your pathogen. The secondary follicles, on the other hand, contains here the germinal center. That's one is being housed by our mature B lymphocyte. I mean, this not the immature, but it's more of the unstimulated. This one is already the stimulated. Because it's already secondary, so mga mature na sila. Again, the primary, it house here your unstimulated na B lymphocyte, mean to say it not yet meet with your pathogen. Secondary naman, that one contains the germinal center, and that one contains here your stimulated na mga B lymphocytes, and it's already become your plasma cell. Okay, our macrophages, those are your tissue phagocytes. Primary spleen could be found here on the marginal zone of your spleen. You call it once your dendritic cell or your littoral cell. So they are the one that try to engulf your pathogen, could be found in your wire bloodstream. It's being delivered to your spleen. Now we go to your lymph nodes. So lymph nodes also act here as our secondary lymphoid organ. So the lymph node could be found here within our lymphatic vessels. Our lymphatic vessels, okay, try to drain. The end part of that is made up of your regional lymph nodes. You have here sa mga inguinal, axillary. Okay, so kung saan siya malapit dapat ang sugat, doon ang nag-inflame, nagkakaroon tayo ng lymph adenopathy. Okay, so the function of our spleen, of our lymph nodes, so this one try to drains your pathogen that could be found within our lymphatic vessels. And our lymphatic vessels contains lymphatic fluid, and that one do not have the RBC. Because our RBC dapat andun lang sa ating blood vessel. Okay, so we have here the basic part or areas of our lymph nodes. So we have here the outermost area, you call it once your cortex. This actually contains our B lymphocytes. So there are, again, you can find the cortex. We have the primary follicles here without the germinal center containing here your unstimulated na B lymphocyte. The secondary follicles on the other hand contains here containing the germinal center. That one contains here already our stimulated B lymphocyte. Then we have here the next area, we have the paracortex. It houses primarily our T lymphocytes, and within that one, malapit siya sa ating antigen-presenting cell, which is your interdigitating cell, which responsible to present, di ba, tinatrap ang ating antigen or pathogen within our lymph nodes It is your interdigitating cells here that try to present it to your T and your B lymphocytes. Then we have also here the medulla na part. Okay, so that one contains the combination of your T lymphocyte, your B lymphocyte, and we have your plasma cells. Other lymphoid organs here, secondary lymphoid organs, we have here your mouth or your mucosa associated lymphoid tissues. So we have your tonsils. The tonsils here try to drain the pathogen that enters our respiratory tract and your alimentary tract or digestive system. Appendix, on the other hand, so this try to drain your pathogen found here within our abdominal tract, lower gastrointestinal tract. And your epidermis, they try to trap here the antigen that try to enter our skin.